Hello everyone. I hope all the students rushing towards the April ORE and the May LDS attempts. And a lot of students do face the difficulty in BDA sheet. So let's start with the BDA sheet called the infection control. And as I have highlighted the important points, and that is going to be really helpful in recalling before exam. So let's just start with the infection control, as I'm not going to start with the infection control in practice and this all. So before that, I am going to take you to the part which is really important. So let's start from the safer shots, and we will cover everything from this BDA sheet in the next video. So probably in the safer shot, there's nothing that we need to remember. It's something that is whatever we've been taught from our dentistry schools. Let's start from the hand protection. Whatever they do ask from the hand protection is the clean hands complement the use of the gloves. Neither is a substitute for the other. Hand hygiene should take place. This question do come on the exam, that before and after each treatment session, before putting on and after the removal of a PPE, following the washing of dental instrument, before contact with sterilized instruments, wrapped and unwrapped, after cleaning or maintaining decontamination devices used on dental instruments, at the completion of a decontamination work. So here's the point, is just like that they give question on this by putting these few statements, and one would be the correct on the exam and rest of would be the false. And the poster illustrating effective hand hygiene should be displayed above every hand basin. Mild liquid soap reduces the risk of hand irritation, and disposable towels for drying help prevent transfer of the microorganism. Hand cream preferably water based. It should be water based. Keep in mind that it should be water based. Will help to avoid the chapped or cracking skin. Ideally, wall mounted hand cream dispenser with disposable cartridge should be used. This part is not that important, but this is something that you know by heart. Moving towards the gloves, and as we know, according to the European standard, that it should be BSEN 455, and it should be in the fitted and non-powdered. The powder from gloves can contaminated veneers, and the radiograph disperse allergic proteins into the surgery atmosphere and interfere with the wound healing. Also, they should below the extractable proteins less than 50 microgram. They do ask this question about the proteins, and if you know the microgram, so that's gonna be the best. It should be less than 50. Alcohol gels should never be used on the gloves. Used gloves must be disposed. So alcohol gels should never be used on the gloves, and they should be disposed of as a clinical waste. Domestic household gloves should be used when processing contaminated instruments and equipment. They should be washed in detergent and hot water to remove visible soil and left it dry after each use. These gloves should be replaced weekly or more frequently if torn or visible soil cannot be removed by the washing. In the latex allergy, as we know all, that it leads to the allergic contact dermatitis is the rare one, but the irritant contact dermatitis is the more commoner with the latex allergy. So whenever we are wearing a gloves in dental practices, so we get on our hand that's irritant contact dermatitis, not the allergic contact dermatitis. We do get it, but it's very rare. So it may cause the individual to cease practice. If you suspect, you should seek the advice from derma. Irritant contact, it's a more common, but can be avoided by selecting good quality gloves and meticulous hand care. Okay, nothing is important in here. It's just like that. If you're allergic to latex, then you should avoiding things which has a latex on it. So you should avoid using the gloves which has latex, any rubber dams, anesthetic cartridges, eye protection example. And as per the eye protection and the face mask, as we all know, this is really important in our practices. So we should wear the eye protection. There was like one question that patient eyes must always be protected against possible injury, and tinted glasses. They do ask about the thing that which glasses, if you are providing to a patient about the eye protection. Okay, what sort of glasses do you gonna give that patient? It's gonna be tinted glasses that protect against the glare from the operating light. Mask, we don't need to remember the numbers, it's just like that. Superficially you should remember it. Why do we use mask? Again, the splash and splatter to for the protection from this both and from the aerosols. Again, that's all. And the respirator, that's EN149. Why do we use it? As an example, active TB, pandemic, influenza filtering face piece device, effective for droplets. It's not that important. Again, I would say the only tinted glass here, it's a really important thing. Surgery clothing, we know all of it, but it's just like that. From these two paragraphs, nothing is important. And removing PPE, they do ask this question on, I guess, every alternate exam they do give this question. So what's the procedure of removing PPE? The number one is going to be the gloves. Ensuring that the gloves end up inside out and without the hands before becoming contaminated. If they become contaminated, wash them thoroughly before removing other PPE. Plastic disposable apron by breaking the neck straps and gathering the apron together, touching the inside only. Face mask by breaking the straps or lifting over the ears. Avoid touching the outer surface of the mask. Never allow to use the mask to hang around your neck. Face and eye protection, taking care not to touch outer surfaces. So number one is that glove. They weren't gonna ask you the details, but they just want to know that how you will remove the PPE in an order. So number one is gloves, then it's going to be the PPE, and then plastic disposable apron, then face mask, and then face and eye protection. So just remember this. Number one is gloves, then we will do the PPE, then plastic disposable apron, and then face mask and the face eye protection. So as per the aerosol and the saliva blood splatter, this is something that we all know, that aspirator should be used, tubing should be used, and rubber dam virtually abolishes saliva blood splatter and should be used whenever practicable. Then the equipment is just like everything is written, no need to read it because it's not that important. One question they do ask from this slide is single-use disposable item. Single-use disposable item must be used only on a one patient. Keep in your mind only on one patient during one treatment session, and then discard it. Item designated as a single use will bear the international symbol. Sometimes they do give this picture on your exam. Number two, what does it mean? This means a single-use disposable item. And sometimes they give this description and you need to tick this either from the pictures. They might be giving you a symbolic thing. So equipment that cannot be safely decontaminated for reuse must be considered single use. That's the basic definition, that equipment that cannot be safely decontaminated for reuse must be considered single use. When their instruments are difficult to clean, single use alternatives, if available, should be considered. Matrix ban, so the examples are which can't be used: matrix pen, saliva ejectors, aspirator trips, and 3-in-1 step. For example, endodontic reamers and files should be treated as single use. So this is again important. They are going to give you the examples either which are the single used odd one out, or either they will give you this symbol. So endodontic reamers and files also should be treated as a single use. If